right. I love that music. All right, good morning again. I want to extend a heartfelt thank you to all of you for caring about the discussions happening today here and for being here. I appreciate all of you. I'm going to start my talk today with a little bit of a personal story on why our mission at Blooming Health is so personal and important to me. So around 5 years ago, 4.5 years ago, in fall of 2020, I had my mother-in-law visiting me and my wife in New York, who was diagnosed with a stage 4 cancer. A young, strong, kind mom, pretty young, unexpectedly was diagnosed with a stage 4 cancer. Me and my wife do not have a lot of family members in New York City. And reminding you, this was October, November of 2020. For folks in New York City, you know how the city looked like at the time. This was a very difficult process for us to navigate. We had to navigate healthcare at this level for the first time, being both of us first-generation immigrants. We had to deal with all the emotional charges that comes in caregiving. We had to navigate the complexity of healthcare, as I'm sure all of you know. But more importantly, when we got out of that healthcare facility every time, we were on our own. We had to deal with everything else on our own. This experience, to say the least, was pretty challenging for us. Unfortunately, after 4 years of fighting with cancer, we lost my mother-in-law last year. We lost her, but her legacy lives with me in our mission at Blooming Health. This personal experience lit a fire inside me, especially knowing that a lot of families out there, like ours, are in need of getting better support, in getting better help, when they're not at a hospital, when they're not at a medical setting, and we're just trying to look for navigating the day-to-day activities of their lives, dealing with their loved ones' needs. This personal experience created a huge drive for me to build and scale Blooming Health alongside with my team. In fact, this is not a very unique experience, especially not in our team. Both of my co-founders had very similar experience with their loved ones. We have team meetings where we talk about our experience with our loved ones, how we provide care, and how we navigate it. Because at the end of the day, healthcare and social care is about families, about lives it touches. From that personal experience, we got to work. We started to build towards a future, a vision where social care is accessible to everyone. An older adult, a new mom, a veteran in need. We wanted to make sure they actually are not far from care when the need arises from them. Fast forward to today, I'm so excited to share how far Blooming Health, our team, and our partners have come along. We started Blooming Health at the peak of the pandemic, right when these things were happening in my personal life in 2020. We launched our first platform in East Harlem just to get some older adults that were high-risk individuals, couldn't go grocery shopping, access to some food. From there, we grew our platform, our partnership, and our movement into 22 states. I'm so proud to share that we're serving 1.5 million people across those states. We have partnered with more than 1,000 organizations, community-based organizations on the front line of services, healthcare entities, government departments, technology companies. We know that it takes a village to solve for social care. And we know we are just a member to enable that. I'm so proud to share that just a month ago or so, we passed 10 million engagements and service navigations with our members in the communities. Just let's take a second and let these numbers sit in with you. 1.5 million people, an older adult in rural Arizona looking for a meal, living in a food desert, not being able to drive, getting a meal they need so importantly. 10 million service navigations. If you are a social worker, if you're a community health worker, you know how many engagements you have per day. Imagine what it takes to do 10 million service navigations. This is what we're so proud about. I want to mention that this progress is possible both thanks to our amazing team at Blooming Health, but also our incredible community partners. Partners that actually believed in us from day one. When I remember in, I think, summer of 2020, our platform didn't even have a user interface, but we got that meal to an older adult in East Harlem. So thank you for believing in us. A lot of you in this room, we appreciate your partnership. I want to mention that this is day one at Blooming Health. We're just getting started. We have pretty bold visions. We, in fact, are trying to build the single platform that delivers the last mile social care, that automates access to social care, that makes access to social care more scalable, more equitable, and available. Because social care is not about 9-to-5 work. The need could arise anytime. We also have a very bold goal for 2025. You see that 1.5? We're trying to get that to 10 million lives by end of 2025. But even with all of that progress and growth, that I'm sure all of you know how hard it is to build in the social care space. Having a fragmented space of stakeholders, all contributing to the lives of individuals in their communities. With all of that progress, our team asked ourselves, how can we reach people anytime, anywhere, when the need arises? Imagine a new world where a new mom, an older adult, a veteran in need, doesn't need to wait until Monday morning to get the care they need. They don't need to wait until tomorrow 9 a.m. to talk to their community health worker to get connected to a home-delivered meal operation. We are trying to build towards that vision. So moving towards that, I'm so excited today and thrilled to introduce Blooming Health's new social care agent. This is an AI-based, intelligent, compassionate, 24/7 agent that extends a helping hand, both to the community members that need the help whenever they do, and to the staff at the social care and healthcare providers that need to care for tens or hundreds of thousands of people every week. This solution can work anywhere anytime, on any device. This is our effort to bring everything you're hearing about AI movement to people that just have a landline, to people that might just be in need of a meal delivered to them. This matters to us because we strongly believe social care should not be about physical access, should not be about the language people speak, should not be about where they live. Social care should be available to anyone that needs it, anywhere they need it. This solution will also empower our partners, all the great community health workers, social care workers, the frontline workers that deliver meals, food, transportation, housing services. This will automate a lot of the manual, mundane tasks you need to do. This doesn't replace human touch, because we all know that people in the most vulnerable moments of their lives need that human touch. But it can extend and augment your ability to screen more people and detect needs faster, to find them a resource that can address their need faster, to follow up with them, to make sure when we talk about closed-loop referrals, it's not about a piece of paperwork being handed over to another staff. It's about someone that is food insecure actually getting their need addressed. So putting the member in the center while augmenting and extending the staff's ability to be able to provide care. This is all about scaling care without scaling the cost. This is why this platform and the work we're doing here matters. But rather than just talk about it, let me actually show you how it works. We're going to do a quick live demo here. Fingers crossed the demons of live demo will not catch us here. So the context here is that the agent is going to call me. He's going to talk to me about food insecurity, try to figure out if I have a need. Based on my responses, he's going to find a resource for me that can deliver a meal to me, sign me up in a SNAP, get me connected to a local food pantry, and it's going to then follow up with me in a few days to make sure I actually got that care. So this is not about just pushing the paperwork to the next entity, but about my need to be addressed. We're going to give this a shot quickly here. So what's going to happen is that I'm going to get a phone call on my cell phone. Let me actually grab the handheld mic. I'll need it to be able to play the sound for you here. Right, I got a call from Golden Care. Hello.
Hi, Nima. We're Golden Care Community Services, checking in about any food access issues you might have. We can connect you with free food programs. We may share your responses with your care team or local partners. Is that okay?
Who is Golden Care?
Golden Care Community Services is a nonprofit organization dedicated to supporting seniors, low-income individuals, and non-English speaking communities by providing essential social services, health resources, and community-based support.
That's great.
Let's go back to our question. Do you consent to share your information with our care team or local partners who can help?
Yes.
In the past 12 months, did you worry that your food would run out before you had money to buy more?
What do you mean food running out?
That means if you've ever been worried your food wouldn't last until you had money to buy more, or if you ran out and couldn't afford more.
Understood.
Let's go back to our question. In the past 12 months, did you worry that your food would run out before you had money to buy more? Often true, or sometimes true, or never true?
Often true.
Did the food you bought ever run out before you could afford more?
Yes.
We're sorry you're experiencing food insecurity. We want to connect you with a trusted organization. Which support option do you prefer? SNAP grocery benefits, free food pantry nearby, or home-delivered meals?
I'll prefer a home-delivered meal.
Nima, do you consent to share your information with God's Love We Deliver for home-delivered meals?
Yes, I do.
Thank you, Nima. Based on your answers and location, we're sending your referral for home-delivered meals to God's Love We Deliver. You'll get the referral details shortly. We'll also check in after 2 days to see if they've reached out. If you need help before then, feel free to call us back. Have a wonderful day.
Pretty amazing, right? That's what dignified care at scale is going to look like. This was in English, because I can only speak Persian besides English, but I could as well speak Chinese here. I could speak Spanish, and I'll get the same level of help I need. This is actually what just happened. A referral was generated. I know our folks from God's Love We Deliver are here. You're not getting a piece of work from me here, but the referral was just sent. They got notified. They now know I need help. And my information was shared with them because I gave the consent. By the way, this could be done for 1 million people in a few hours. You don't need a large 2,000, 5,000 care management team to do this. You can do this literally with 5 people, just monitoring what's happening for these people at scale. I know I'm running a little short. I'm gonna just need a few more minutes just to wrap up here. So you've just seen our technology in action. Let's just zoom out a little bit. Let's see what this means to families and organizations that care for these families. In fact, our team has put together a 1 to 2 minute video here that I want to play for you. This video is about hope. It's about how the future of care could look like. Not just for the families that need help, but also, as all of you know, for the heavily overworked care managers, community health workers, social workers, the frontline staff that are caring for our loved ones. This video is gonna tell this story much better than I can do or can say anything on the stage. So without further ado, let's
Right now, millions of people across the country need social care. Food, housing, transportation, connection. But outdated systems, manual processes, and infrastructure barriers are slowing everything down. Thousands of organizations are struggling to keep up, and billions of dollars are wasted on the cost of care or services by government and healthcare stakeholders. What if social care could move as fast as the need? With Blooming Health, it can. Blooming Health is transforming social care with automation, removing barriers, closing gaps, and making sure no one falls through the cracks. From food insecurity screenings to transportation assistance, Blooming Health automates outreach, screening, and closed-loop referrals in the right language, at the right time, on the right channel, text, voice, or email. No pending referrals. Just real-time automated support that meets people where they are to address their basic needs. Members no longer need to navigate complex phone menus. Blooming Health's intelligent AI agent can have natural conversations in 80+ languages, detecting needs, dispatching service, and being the member companion along the service journey.
Maybe once or twice, I usually manage okay.
Our team will review your responses and get back to you soon with information about resources that may be helpful.
This dramatically increases engagement with hard-to-reach populations and helps them get their basic needs addressed at a fraction of cost and time. They're impacted faster. Because social care isn't about forms and systems, it's about people. And when technology works for them, everyone wins. Smart, scalable, inclusive. This is the future of social care. Join us in transforming the way we connect support, and empower communities at scale with automation. Let's build a world where service reaches those who need it, effortlessly.
All those smiles that you saw, the moments of relief, that's what drives us every day. That's why I'm so excited to share today that we as an organization are getting a boost to be able to even extend this work further and scale it up nationally. So I'm excited to announce that Blooming Health just raised a $26 million funding round to support our growth and bringing this platform to 10 million people by end of this year. I'm so thankful to our investors, Insight Partners that led our round, and our past investors, Afore Capital, Crossbeam Ventures, and Metrodora that believed in us from early on and doubled down in their conviction. I also want to thank our community and partners. All of this wouldn't be possible without you. Just to give you a little context on what we're going to use this money for. First, we're going to expand our technology, our capabilities. The goal here is to save more times for organizations that are serving the individuals in need, so they can serve more people, so they can serve them at lower cost. More importantly, we want to help serve more people, so there's less people falling through the cracks. Second, we're expanding nationally, as you see. We have very bold goals for the year, and this is going to fuel that growth. Third, for all of you in this room, our existing partners, this doesn't just go into expanding our surface area. It goes into deepening our relationship with you. We're going to build more solutions to make your operations easier, to care for your communities better. This whole opportunity hopefully will mean and fuel millions of lives getting a little easier. More meals delivered to people that need them, more moms and older adults getting the care they need in a timely manner, more of those smiles that you saw over there, and more of the families like mine, like ours, getting the care they need in a timely manner. I'm going to wrap up here in 30 seconds. I know our team is in rush here. So at the end of the day, any amount of technology and funding wouldn't really matter if we're not improving lives. Our mission at Blooming Health is simple yet profound. We're envisioning a future where a mom that is trying to care for their newborn doesn't need to be worried because they can't get their newborn the basic care they need. A future where an older adult can age in a dignified way in their communities. A future where caregivers are not standing up at night alone thinking about their loved ones and how they could solve some of the day-to-day problems they might face. But we know this future takes all of us here. Takes a former president to join us. Takes technology entrepreneurs to join us. Takes community-based organizations to join us. Takes healthcare executives, leaders to join us. I believe our generation is positioned, because the pain is so high, by the way, I believe our generation is positioned to actually address the social needs gaps in our communities, to reduce poverty, to make social care a more integral part of healthcare, because it should be. I believe it, we believe it, because we see the commitment and passion in this room. Back in 2020, me and my wife were two worried caregivers searching for answers. Today I stand here, no longer alone, but with all of you, a whole community, answering that call. I think together we'll make social care bloom in every community. Let's build this future together. Let's build this compassionate future together. Thank you. Thank you so much.